Our next topic is acute disease versus chronic disease. Acute disease are those which are having shorter period. Acute disease are only for short time. Every person can suffer with such types of acute disease at one time and any other time. Any person. Every person suffers from someone suffering from common cold, coryza, viral fever. These are the acute disease. Cough. Because being of the shorter duration, it does not damage any organ. So acute disease are for the shorter time. Any person can suffer from these acute disease in their life. Being for shorter time, acute disease does not damage any organ. Now come to the next point, that is chronic disease. It is long lasting disease. Chronic disease is having the long duration. For example, tuberculosis, elephantiasis. Only some person, not everyone, only some person suffer from chronic disease, and these chronic disease may damage the organ of the individual patient because he is suffering for a long with this disease due to prolonged duration. Are you getting me?
Sure.
Next, recovery. In case of the acute disease, recovery occur within a short period of time. Recovery is generally completed in a shorter time after the treatment. But in case of the chronic disease, the recovery complete after a long time period of the treatment as well. The effect of acute and chronic disease. In case of the chronic disease, suppose you are suffering from the common cold. Will you feel any loss of weight? No. So, there is neither loss of weight nor feeling of prolonged weakness in case of the acute disease. But in case of the chronic disease, there is often a loss of weight. Vajan kam hoga. By feeling of tiredness. Patient will feeling tired. So lot of weight is accompanied by feeling of tiredness. So what are losses during the acute disease and chronic disease? Main loss is of if a person doing a duty, doing a job, or a student studying in the school. In case of the acute disease, because they are for the short duration, so interruption of work and loss of efficiency are of shorter duration. Not only a loss of work only for 1, 2, or 3 days. But in case of the chronic disease, interruption of work and loss of efficiency are prolonged. Lot of loss. Some example of acute disease are common cold, viral fever, diarrhea, typhoid, cholera, and some example of chronic disease as I have discussed: tuberculosis, elephantiasis, and diabetes. Is that clear?